Right now, it's being used to treat acne to the tune of about $1,000 a tube.
Yep.
But it does interfere with the androgen receptor, which is involved in the production of acne, or at least that pathophysiology. And in theory, this should. All right. And then last but not least, we have a commercially available androgen receptor antagonist that you probably didn't know about. Or if you knew about it, you probably didn't know it was a androgen receptor antagonist. And you brought this to my attention at least a year ago, I think, when the initial approval came through. So we have Winlevi, or topical clascoterone. Right now, it's being used to treat acne to the tune of about $1,000 a tube. But it does interfere with the androgen receptor, which is involved in the production of acne, or at least that pathophysiology. And in theory, this should work for androgenic alopecia as well. I think they're looking at a higher potency. I don't know for sure, but it's going to be the same drug, just
foam
in a different vehicle for androgenic alopecia specifically.
One of the proposed names, or maybe it was the European name, is Breezula, but it's still just topical clascoterone. And again, this is similar, as we mentioned before, to RU58841. So that's kind of the third topical androgen receptor antagonist. It's nice because we can actually see the phase 2 and phase 3 data for this, at least from the Winlevi perspective, where for whatever reason for RU58841, which has been studied and been abandoned, the trial is complete and they have the data, but it is not published.
Yeah, it's really a misfortune. The RU seemed quite effective in stump-tailed macaques, but apparently it was not effective enough in humans for them to bring it to market.
Another thing of note with clascoterone is, despite being approved for acne and specifically androgenic acne, it is difficult to get covered. Even if you have both acne and your acne happens to be in the area of your scalp where you also have alopecia. With the acne, it does not seem to have as good of efficacy as you would think. For example, someone with PCOS or someone that's sensitive to androgens that has acne, likely because there's other reasons like your skin microbiome. See our podcast with Dr. Thomas Hitchcock for that, and his Zycrobe topical skin microbiome. Also sebum production, it's not going to completely control for that. Estrogenic inputs, sweating. There's a lot of even pressure and friction. There's a lot of things other than just androgen receptor activity, even in androgenic acne, even if it's like classic jawline or whatnot. The results have been okay, but usually somewhat underwhelming if you're using it as a monotherapy.
Yeah, it doesn't seem to be a magic bullet. I mean, people are probably going to be stacking this with traditional methods like retinoids, calming down inflammation, restoring insulin sensitivity, and maybe topical antibiotics here and there. Like you said, we talked about earlier, having a little bit of each mechanism involved tends to lead to the best outcome. Even if not every one of the treatments is a home run, you can still get a really good effect by adding a little bit of each thing.
Yeah.